I'm going to talk about a little bit about what I have done in the latest few years before diving into the presentation about the connection between forest, water, sanitation, and hygiene and diarrhea. So, as Maya said earlier, I have a background in nature conservation, but in the latest few years, I have joined the planetary health field in an effort to combine nature conservation and public health. And before joining Cornell, I was at the Ghana Institute for Environment as a postdoc associate. I worked with Taylor Ricketts and Brandon Fisher, and we worked on data from multiple countries to look at the links between nature and health, mainly forest and human health and nutrition. And one thing that I got, one of the things that I got from the Gandhi Institute is a network, professional network. My current job at Cornell is a product of that network. I was introduced by the people I'm working with at Cornell right now through my Gand connection. And through my Gand connection too, while I was working as a postdoctoral associate at the Gandhi Institute, I had the opportunity to interact with a lot of people from different universities, from different organizations like USAID, WWF, and the Nature Conservation, and many more. And I'm still using those network right now in my current work, but they will also be helpful resources for my future career, I think. So if you are a Gand student or a Gand follow right now, just take advantage of that opportunity to network. The people at Gund, they are really connected. So that will be a very nice resource for your career. So that's a little bit about my connection with the Gandhi Institute. Now let's dive into my presentation. And today I'm going to share my research, which takes a planetary health approach to understanding one of our most pressing environmental problem, which is forest loss. So I will talk a little bit about planetary health, what's planetary health, and then I will present my research looking at whether forest loss could undermine the effectiveness of water, sanitation, and hygiene efforts designed to reduce diarrhea. So let's start with planetary health. The world has made significant progress in areas of public health. For example, the rate of child mortality has declined over the latest 2 centuries. In this figure, for example, the vertical axis represents the share of the world population dying or surviving the first 5 years of life. And the horizontal axis represent years. So in the 1800s, over 40% of the world population died before the age of 5. But today, that number is 10 times lower. Less than 4% of the world population die before the age of 5. But at the same time, the world's natural system or ecosystem have been degraded at an increasing pace and extent. For example, this figure on your right show the annual loss of global and tropical forest between 2001 and 2017. The vertical axis represent hectares of lost forest and the horizontal axis represent years. So in 2017 alone, the planet lost about 40 American football fields of tropical forest per minute. So when ecosystems are degraded, the benefits we obtain from this ecosystem, called ecosystem services, are gone. And a number of ecosystem services are important to health. For example, ecosystem services important to health provided by forest include wild food like berries, mushroom, and wild meat. Regulation of some infectious disease. For example, there are studies suggesting that forest regulates the transmission of malaria And pollination is another service which is important for food production, and forests also filter water and the air. So there has been concerns that the loss of ecosystem services caused by ecosystem degradation could counter or even reverse some of the progress made in public health. And these concerns have given birth to the field of planetary health, as detailed in the Rockefeller Foundation report on planetary health, prepared by the Lancet Commission on Planetary Health. And planetary health is then a field that focuses on the effects of natural system degradation on human health. And today I'm going to talk about a research that directly tests the concern that ecosystem degradation could counter or even reverse some of the advances the world made in public health. Particularly, I looked at whether upstream forest loss could undermine the reduction of diarrheal disease stemming from water, sanitation, and hygiene interventions or WASH interventions. One of the public health areas where the world has made great progress is in reducing deaths caused by diarrhea. This figure shows the annual deaths from diarrhea differentiated by age groups. The vertical axis represents the number of deaths, and the horizontal axis represents years. The blue areas represent child under the age of 5. So from 2000 to 2015, the number of children under the age of 5 dying from diarrhea halved from 1 million in 2000 to around 600,000 in 2015. That's a progress. The progress in reducing deaths from diarrhea is partly due to improvement in access to water, sanitation, or hygiene, or WASH. The figure on the right shows the annual number of the world population using a given drinking water source. The vertical axis represents the number of people, and the horizontal axis represents years. And the blue and green areas represent improved water sources. So from 2000 to 2015, additional 1.6 billion people has had access to improved water source. That's a progress too. But at the same time, as I showed earlier, we are losing forest, particularly tropical forest, at an increasing rate and extent. So my research question is whether forest loss undermine the effectiveness of those WASH efforts designed to reduce diarrhea. So I first looked at the effect of WASH on diarrheal prevalence, represented by the arrow starting from WASH and pointing to diarrhea in this figure. Then I looked at whether forests moderate the effects of WASH on diarrhea. Specifically, I looked at the effect of water improvement efforts, namely piped water source and point of use chlorination, on diarrheal disease. Studies show that good raw water quality improves the effectiveness or reduces the costs of water improvement efforts. There is also evidence that forests enhance raw water quality by filtering pathogens, sediments, pollutants, and contaminants. Therefore, I hypothesized that forests moderate the effectiveness of water improvement efforts by improving raw water quality. The study was conducted for Honduras, Haiti, Nigeria, Democratic Republic of Congo, Uganda, and Nepal. To estimate the effect of WASH on diarrheal prevalence, I compared the prevalence of diarrhea in children with access to WASH and children without access to wash that are observably similar. That is, the children I compared are similar in terms of age, mother's education, household wealth, and many other variables. This was done to ensure that the difference we see in the comparison is not due to these different variables, but can be attributed to wash. And then, to estimate the moderating effects of forest, I examined how the effects of forest on diarrhea, previously estimated, vary with increasing upstream tree cover. And this is one of the results. This figure shows the effect of piped water source on diarrhea. This figure shows how the effects of piped water source on diarrheal prevalence vary with upstream tree cover. The vertical axis represents the effect or effectiveness of piped water source compared to non-piped water source at reducing diarrheal prevalence. And the horizontal axis represent upstream tree coverage. The red lines represent zero effect or no effect of piped water source on prevalence of diarrhea. And everything below the red line signifies that piped water source reduced prevalence of diarrhea. And everything above the red line signifies that piped water source increased prevalence of diarrhea. And the blue band represents a 95% confidence interval. Piped water source significantly reduced child diarrhea only when upstream watersheds are moderately forested, approximately between 10% and 60% upstream tree coverage. And it is most effective at approximately 25 to 30% upstream tree coverage. At low upstream coverage, that is below 10% upstream tree coverage, piped water source did not have significant effects on diarrheal prevalence. And at high upstream coverage, that is at more than 60% upstream tree coverage, we again detect little effects of piped water source on diarrheal prevalence. And this is another result. The graph on your right shows the effect of point of use chlorination on diarrheal prevalence, how the effects of point of use chlorination on diarrheal prevalence vary with upstream tree cover. And it shows a kind of similar pattern to the one on the left that I described earlier. Both curves have some U-ish shape, but the concavity is a lot more pronounced for the one on the left than for the one on the right. So what can we learn from these graphs? The finding that the effectiveness of piped water source and point of use water chlorination is not significant at low upstream tree coverage supports the concern that forest loss could undermine the progress achieved by wash interventions against childhood diarrhea. When upstream areas of watersheds have low forest coverage, for example, because of deforestation, downstream raw water quality can become poor because there is very little forest to filter water upstream. And the poor quality raw water in turn can render water improvements efforts less effective at removing pathogens. For example, high turbid water rapidly clog filters that are often installed with piped water source facilities. And such clogging can cause the degradations of the filters and breakthrough of the pathogens. And turbidity can also shield pathogens from disinfectants like chlorine used at source, that is, for example, in water treatment plants or at point of use. So while technologies can still treat poor water raw quality, they may cost more and therefore be less accessible, particularly for poor communities or households in low-income countries who cannot afford expensive water treatment. So another thing that we can learn from these results too is that the results confirm the important role of forested watersheds in the multiple barrier approach to drinking water provision. The multiple barrier approach stipulates that a number of consecutive barriers to sediments, pollutants, and contaminants from source watersheds to treatment and distribution are needed to ensure safe finished drinking water. Forest watersheds can act as early barriers to improve raw water quality and thus increase the effectiveness of subsequent barriers. And we can see that in these figures when upstream watersheds are moderately forested. When upstream watersheds are moderately forested, the effectiveness of piped water source and point of use chlorination are significant. Moderately forested watershed may filter raw water to an extent where the concentrations of sediments and contaminants still need reduction to avoid diarrhea, but those concentrations are not high enough to undermine the effectiveness of piped water source and or point of use chlorination. But these subsequent barriers to pathogens, contaminants, and pollutants can also be simple or inexpensive facilities or technologies if raw water attains a high quality level, as can be the case when upstream watersheds are highly forested. Water filtration by abundant upstream forest can lead to a high quality raw water. And in these cases, water technology may not add much benefit, as shown in these graphs when upstream watersheds are abundantly forested. And because water technology add little benefits, only simple or inexpensive technology may do the job. And that can be important for poor communities in developing countries who cannot afford expensive and sophisticated water treatment technologies. That's about the results. And now I'm going to conclude. So, in conclusion, we can see that forests moderate the effectiveness of WASH efforts at reducing diarrhea. That supports the concerns or the idea that the degradation of ecosystem can inverse or even counter the progress we made in some areas of public health. And one important thing to notice too is that we also saw that forest may matter most for the vulnerable. As we see earlier, if upstream watersheds are abundantly forested, those poor people downstream may not need expensive water treatment technologies to treat their water and to prevent diarrheal disease. Maybe some just very simple and inexpensive technologies or facilities could do the job. And an implication of the results too is that forest conservation investments can be public health investments. And that has multiple implications. For example, people interested in public health may want to think about forest in the investment they make in public health. For example, if they make investment in WASH or other or any kind of water treatment technologies, they may also want to think a little bit about forest conditions upstream, which may help to achieve their goals. But yeah, though conservation investments can be public health investments, conservation does not necessarily translate into public health outcomes. for example, I talked about all the progress that some of the progress that the world made in terms of public health earlier, and some of those are have been done at the expenses of ecosystem. So it may be in some instances that leaving the ecosystem where they are, if that is done, it may be that we don't really get those progress. So and another example is protected areas. For example, restrict access to forest products that may be important for public health. So if we do conservation, we have to bear that in mind too. And my goal for the next few years is to dig a little bit more on that, on how to make conservation more health sensitive, so that conservation can deliver both health and conservation benefits. And thank you for listening. And if you have any question, I do my best to respond to your question. Thank you.
Thank you so much, Ranaivo. That was really wonderful. And I loved how you ended with saying that we would love for conservation to be more health-centered. So just a reminder to go ahead and put your questions that you have for Ranaivo in the Q&A box. I see one in the chat box, and so we'll try to move that over into the Q&A area. And as the questions start to come in, I was just curious, Ranaivo, you're familiar with Madagascar, of course, and the rainforest in the northeastern part. And so I was wondering what your thinking is around the prevalence of childhood diarrhea in the continued presence of childhood diarrhea in an area of the country that is still primarily forested.
Yeah, that's a good question. I don't know if I have a good answer for that question or not, but you're right. Childhood diarrhea is still prevalent in that particular area. This research doesn't say that we don't need all the wash efforts that are needed to prevent diarrhea. Like an extreme view of things may be like, well, just like plant forest. When you have forest, then water is clean. We don't really need anything to add to add. But this what I think this piece of research tells is that we have to have some kind of system thinking. So rather than just focusing on improving facilities or technologies that households have access to, maybe we can think a little bit more broadly and think about those forests are already there, right? They can make use of them, and at the same time still using the technologies to improve things further. So it's not the one or the other. It's not forest or wash technologies, but it's the one and the other. But the idea is that forest makes things easier, maybe for those poor households because they have abundant forest upstream. They don't really need like a huge sophisticated water treatment plant, but maybe just a little bit of technologies which they can afford. They can prevent some of the diarrheal disease happening in their community.
Thank you. So we have some questions coming in. Taylor Ricketts is wondering if you know of any public health efforts that explicitly target ecosystem restoration or conservation, and if anyone is already taking your advice to blend these perspectives.
Yeah, I think that TNC, the Nature Conservancy, is working on that. They're looking at the different big cities. They have some threshold on the number of populations that define a big city. across Africa and looking at how um, they can restore upstream forests to benefit um, those big cities in Africa. And yeah, we have been in touch with them. They were quite interested in our findings, and I think that they will be in contact uh, with us in the future. But yeah, there's something going on. That's one particular effort. And I just read a paper a couple of months ago about Madagascar, that people, they are not conservation people, they're not ecosystem people, they're just public health people. But they wrote a paper published in PLOS ONE, if I remember it well, and they recognize in that paper that the capital city, Antananarivo, there was a degradation of water, drinking water quality, not only the raw drinking water quality, but the drinking water coming into people's household in the capital. There was some degradation of the quality of that, and they do recognize that that is partly due to like the massive deforestation in upstream areas, and that we need to think a little bit more about that rather than just building water treatment plants, which the city the city needs that now, of course. But yeah, they recognize the importance of nature, and that's a good thing in the right direction, I think. Yeah.
Thanks, Ranaivo. So another question, this is from Tim Truer, who's also working in Madagascar. He says, what is going on in the 0 to 10% upstream forest cover range, and why might very low forest coverage be better than moderately low forest coverage?
Let me share my screen again. Okay. So, yeah, like at very low forest coverage, piped water source and point of use chlorinations, they are not effective at reducing diarrhea. And a potential explanation for that is when upstream tree coverage is very low or almost inexistent, then raw water quality downstream is very bad. And therefore, those efforts like piped water source and point of use chlorination, they may not be as effective as they should be when dealing with the pathogens, because the raw water quality is really bad. I said earlier the examples that like when water is really turbid, chlorine is not effective at all, because the sediments or particle in suspension in the water, they shield the pathogen against the action of the chlorine. So if you have a very raw, very turbid water, chlorine doesn't really work. And but at moderate forest coverage upstream, an explanation may be that, well, because they are moderate forest upstream, then the downstream raw water quality is at a certain level of quality that piped water source and chlorination can deal with them pretty much, so that those efforts have significant effect on diarrhea. That's just one potential explanation. And when there are a lot of forest upstream, 60% or more, then maybe an explanation is like forest raw water quality is has very high quality. And then if those like piped water source and chlorination, they don't really add much benefits anymore, because the raw water quality is already pretty good. That doesn't mean that when, as I said earlier, that doesn't mean that when like there's a lot of forest up there, we don't need piped water source or chlorination anymore. It just means that maybe some very simple technology is enough to get rid of the remaining pathogens or contaminants. So that those are potential explanation, and those are still like avenues of research. Those are just explanation just from our understanding of the topics, but I think that we can test a lot of things. Yeah.
Great. And that leads to a good follow-up question, again from Taylor. What studies could be done next to test whether the impacts you found are due to the mechanism you propose, raw water quality, sediment clogging, etc.?
Yeah, that's a good question. I haven't really thought about that, so my answer may not be good, but I think one, a very good research to do is going to different communities with different level of upstream tree cover and really look at the quality of the raw water coming to these different communities. And if that shows, if that really shows that, yeah, when there's very good upstream tree coverage, then the raw water quality is better, then that will lend support to the findings we have. And at the same time, doing some intervention, different wash intervention in these different communities to look at how those different wash intervention interact with the different types of raw water quality. Because if we are able to do those kind of research, we can really see the link between forest upstream, raw water quality downstream, and then the quality of raw water downstream and effectiveness of wash interventions. That will require quite an investment because that's going to be kind of a complicated, and maybe it will have some large scale because you can't do it at household level. You have to do it at community level, and different communities of having different upstream forest coverage. But I think if the willingness is there, it's feasible. It can be done.
So just waiting to see if any more questions are coming in. I had another question just in terms of the makeup of the forest stand. I know your research didn't look at this specifically, but what are your thoughts on that? Or, whether it's a primary forest versus secondary forest, does that make any impact?
Yeah, we didn't look into that. We just look at like percentage forest coverage. So if you're thinking about, yeah, that classification is kind of a Madagascar classification. Primary forest is like mostly undisturbed forest, and secondary forest it has it was disturbed a little bit or clearly cut, and then it grow again, and then that's the secondary forest. So we didn't dig into the types of forest, but just from these figures, like 20 to like from 25% to 30% of forest coverage is where we have the highest impact of wash interventions. That doesn't mean that we have to have like a very dense forest to make things better in terms of reducing diarrhea via wash. So maybe even a secondary forest will work, but it just like the less the forest coverage, then it will require more sophisticated wash technology to treat the water.
So another question, someone's wondering if you could talk more about the work that you're doing now and in the work around Lake Victoria in Kenya.
Yeah, my plan was to present that work for this presentation, but something in the data didn't work quite well, so I have to switch, but I will be happy to talk about it again next time. But what I'm doing right now is we have a very fine data in a lake in the Kenyan part of section of Lake Victoria. The name of the island is Mfangano Island. So they have doing quite an extensive research there, looking, and we have longitudinal data. And they already use this data quite a lot, but what I'm doing is linking fisheries with child development to see if like any change in their in those people that depends heavily on fishery, if changes in their income that they got from fishery that have impact in their in child development, or if like the quantity of fish consumed by children have impact on their child development. And the good thing about that is like we have fishery on one end of the causal chain, and we have child development on the other end of the causal chain, and we have different variables in between those two ends. So my goal really is not only to look at the effect of of X on Y, but like how does X affect Z? How does fishery affect child development? And the hypothesis we test now is through income, because those communities quite rely heavily on fishery for their income. So that's one pathway, like fishery that affect people's income, and we hypothesize that income then impact child development. And the other mechanism that I said earlier is like fish consumption. Like when they have more fish, they eat more fish, those kids eat more fish, then they get more fatty acids, which is really important for child development. So we hypothesize that that will have effect on child development. But one tricky thing is it's just fish. It's not that they eat fatty acid, it's just fish. So it's quite complicated. I just look at the data, right? I'm working on it, and it's really complicated, but I will be happy to talk about it in the future.
Oh, that sounds really exciting. I hope you'll share it with us. We have another question from Natalia. She says she's curious about other co-benefits of forests for public health, specifically thinking of the benefits to mental health. And do you know of potential collaborations or other groups that are looking at different dimensions of public health and the connections between forest, mental health, and access to water quality?
Yeah, there are a growing number of people doing those things right now, those research. Here at Cornell, I would say that our group is the one who are really looking at it right now. And we are trying to work with economists, like if you know, like Chris Barrett, we are working with him, try to have some economics perspective from him, and we are working with the nutrition department, etc. So there is, it's starting at Cornell. That's what I mean, the Gand is way, way far away if compared to what we have here in Cornell. The Gand is way in advance. But in terms of collaboration, I think, yeah, there are a lot that can be done. I was just contacted by a person from CI just yesterday that she's interested in knowing more about those things. I think she is the water scientist lead at CI in Washington, DC, and she's just interested. So yeah, there are potential collaboration there. And but I think like about mental health, because the question is about mental health. Most of the studies on the connection between nature, forest, and mental health are in developed countries. There are fewer research studies about that in developing countries. So I think that's another way to explore. Like, does forest impact mental health in developing countries? That's a good way, a good question to explore. But yeah, it's a new, not really new. It's kind of a new field, so there's a lot of potential in there. And just if I still have a little time talking about that, the reason why I joined, as I said earlier, and as Maya introduced earlier, I was more in the conservation side of things, not in the health side of things when I did my PhD. I looked at how community forest management affect people's well-being. So not really connected to health. But then I did an interview in the middle of rainforest in Madagascar. I interviewed like hundreds of households there. And I was just asking to them, like, what's the most important domain in your life? And health is always there. Of course, agriculture is the top because all of them are depend on agriculture, but health, if not the second, then the third. Communal health is very important for us. And that's what made me realize that if I really want to connect with these people, if I want to do things that they will receive and accept, then for agriculture, a lot of people have already worked on agriculture, but on the health side, there are not many people working on that. And that's why I decided, well, if there's an opportunity to get involved in the health side of conservation, I would do that. And that's why I joined the GUNT and now at Cornell doing the same kind of research.
It's so great that you're involved in that research. It's really important. And it's wonderful to see the planetary health field growing and so much more attention. We still have a few more minutes. So if anybody has a question they haven't asked, please go ahead and put it in the chat box. We'd love to hear what you're thinking.
Okay, that was nice talking to you all.
Really nice talking with you, Ranaivo. Natalia asks again, have you looked at forest quality, such as age or structure of the forest, or to other aspects of the landscape, such as land uses around the forest, to know which other factors may be influencing the effectiveness of WASH to prevent diarrhea? We talked about that a little bit, but yeah, other aspects of the landscape.
Not really. I didn't dig into that. But there was a research, if not Natalie, is interested about that. There was a research that was published maybe in July, or I don't know. It's in. It's not about WASH, but it's the connection between forest and nutrition. And the author really digged into that, like how forest is positioned in the landscape. So rather than just looking at forest and nutrition, she digged a little bit into that. So that may be an interesting publication. I don't really remember. Maybe it's in global food security. Maybe that's the name of the journal. But unfortunately, it's not about WASH. Yeah. So I can't really give any answer on whether what effect that could have, but practically, yeah, I think that have some effect.
So I think we still have time for one or two more questions. If anybody has anything else they'd like to ask Ranaivo. It's a cold, rainy October afternoon here in Vermont. So
yeah, it's the same here.
Everybody wants to curl up in bed with a book and a cup of tea.
And just feel free to drop an email to me if you have any question in any things that I said earlier, or even the current work that I'm doing, like child development and fishery. If someone is interested, just let me know, because I want to hear from you. Really, yeah.
Well, I will definitely take you up on that as I'm thinking about agriculture and in Madagascar. But thank you so much, Ranaivo. It's really been lovely hearing what you've been working on. And I hope that you'll come back and visit us here in Vermont when you can.
Yeah, sure. Thank you, everyone, and have a great day.